Good evening. My name is Asher Kemp, and I am the Executive Director of the Coalition of Culturally Competent Providers. And I'd like to welcome you to this collaborated event with the Coalition of Culturally Competent Providers and the Hispanic Coalition, as well as the Office of Intellectual Disabilities. When we put this event together, we thought about the communities that we serve and really wanting to make sure that we put resources in people, especially through the presentation this evening. On the chat, if you can just note where you're from, if you're from the Philadelphia area, anywhere in Pennsylvania, that'd be great. So for us to just get an idea of where people. I'd first also like to thank all our panelists for volunteering their time to be a part of this lovely event tonight. So with that being said, I will introduce our MC, Hector.
Hello, and thank you very much, Asher. Truly appreciate your effort, your work, and your dedication to our communities. I'm Hector Ayala, CEO for Hispanic Community Counseling Services and co-chair for the Latino Behavioral Health Coalition. And today I will be your moderator. First, again, I would like to, on behalf of the Latino Behavioral Health Coalition, the Department of Behavioral Health and Intellectual Disabilities, the Coalition of Culturally Competent Providers, as well as the Society of Ibero Latin American Medical Professionals, I want to thank you for your interest in seeking tools to educate your community about COVID-19 and existing resources to combat the pandemic in our communities. This is a volunteer effort by a group of physicians, mental health professionals, social workers, educators, community workers, and advocates from multiple coalitions and organizations across the city. This virtual town hall event was designed for those who do culturally or population-specific work in the community. For example, case managers, mental health professionals, community health workers, home visitors, patient navigators, peer support specialists, nurses, physicians, you name it. And as you may know, now, COVID has changed completely all our lives. You know that now worldwide, we have over 40 million people infected. Out of those 40 million people infected, over 1.1 million deaths globally. Just in the United States, we have over 200,000 deaths during this year. And just in Philadelphia, we have 1,800 deaths, which is composed 21% of the total deaths that we have in Pennsylvania. So in response to this growing concern around access to services and education regarding COVID-19, this event was created. I have to make very clear that for those of us who work in the community, it is important to understand our communities and that we work in. It is imperative that us as professionals and community members, we conduct an inventory of community resources by asking certain questions. For example, what are the programs or other assets that we have existing in our communities? Who's providing these resources? Who is receiving these resources? Where are these resources located? And where they're available. And I think the most important thing is that how these resources address the risk and protective factors within our communities. So our objective today is to offer a compiled source of published and publicly available resources regarding best practices to prevent and manage COVID-19 infection, as well as available community assets to address the psychosocioeconomic issues that we have in our communities. With that, I would like to now highlight the organizations and the coalitions that are making this event possible. So first, I would like to ask Asher Kemp, the chair for the Coalition of Culturally Competent Providers, to tell us a little bit about your organization and the work that you're doing in the community, Asher.
Sure, thank you, Hector. The Coalition of Culturally Competent Providers was established about 5 years ago by a group of mental health and human service providers that came together to commit to sustainable resources and partnerships and models of culturally competence, excuse me, best practice, policies and procedures for communities of color. And we currently, the group of coalition members currently service over 20,000 individuals throughout the city of Philadelphia and surrounding counties. And much like my colleague Hector, we have been doing a number of things around supporting our communities and bringing resources out to everyone. Very similar to this platform, and trying to make sure that we keep people safe. We've done a number of things around looking at the social and emotional aspect of individuals through this pandemic. So we had a platform that dealt with that, where we had psychologists, doctors, the school system, and I'm recognizing some of our people that were a part of that, even a part of this event. So I think for both of us, this continues for both of our coalitions to be the mission of really making sure that we're providing services for community. So thank you, Hector.
Thank you, Asher. Truly appreciate it. Now, I would like to introduce to all of you guys from the Latino Behavioral Health Coalition, Mr. Antonio Valdez.
Hi, everybody. Great to see many of you I haven't seen in many months, so it's really great to at least see you on camera. The Latino Behavioral Health Coalition was established in 2011, and it was a group of behavioral health providers who provided a significant amount of service primarily in the eastern North Philadelphia part of the city that came together to organize this coalition. And as a purpose, we really saw it as a place that we could advocate for better behavioral health, for excellent behavioral health services in the community, but also for the fact that there wasn't anybody communicating with the city, with the Department of Behavioral Health and other groups about what kind of services we would actually need and what they should look like. So it became an organization that began to advocate for the kinds of things that the Latino community saw as important in terms of what services should look like. And it really, from a philosophical perspective, was based on a better understanding of the linguistic needs, the cultural needs, socioeconomic barriers, building expertise in behavioral health services in the Latino community. And you guys might remember that the thing we're most known for, which obviously for obvious reasons isn't happening at the moment, is our annual symposium that we've been doing for many years at this point, that hopefully, knock on wood, we'll be back next year if you know, the universe allows. Historically, Latino Behavioral Health Coalition has provided services through over 50 different programs located in 25 different sites. It's provided by over 1,200 staff, and over 35,000 families have been served. And at the end of the day, we believe that excellent behavioral health services partnering with social justice leads to emotionally, physically, and spiritually healthier individuals, families, and communities. So again, keep your eyes and ears open. We are, just like our partners in this event, we're trying to do a lot of events in the meantime, smaller events that we can bring people together virtually. Hopefully soon we'll be able to do some things live, but please join us as best you can. And anybody interested in participating even more with us, please feel free to reach out to Hector or I. We'd be happy to have more people involved with us. So enjoy today. Have a great day. Thank you, Hector. You're muted.
Thank you, Tony. Thank you very much for your words. Truly appreciate it. Now I would like to introduce Dr. Natalia Ortiz. She is with the Society of Ibero Latin American Medical Professionals. You have to unmute yourself. Unmute.
Thank you. Hi, good afternoon. Thank you for the invitation. The Society of Ibero Latin American Medical Professionals is a nonprofit organization of healthcare professionals that have a heart for the Latin American community in the Delaware Valley. We've been together since 1992, and our mission is to decrease that gap of the low representation of Latin American healthcare professionals. We advocate for that. We also advocate for the health disparities, to address the health disparities seen in the Latinx Hispanic community. We have several committees. The most active committees are the Public Health Committee, which involves activities like the ones that we're doing today with the community. Before COVID-19, we were doing workshops, presentations in TV, written media, social media. We have a YouTube channel. We're very active in social media. We meet every Monday, talk about public health issues. We also have the Wellness Committee to take care of ourselves as healthcare professionals, but we are also going to expand that to the community. So it's called Salam Bienestar. We have been providing scholarships to the students of Latin American descent that want to pursue career in healthcare since 1998. We have been mentoring the mentor that wants to help the students that have difficulties getting into the healthcare profession. We have been doing this through several medical schools since 2017. As well as we want to help the healthcare professionals in the advancement in knowledge. They have knowledge, but we all have to learn more and more as the advances in sciences progresses. So as part of that, we have the Carlos Finlay Conference that provides the CEs or continued education credits. We collaborate with other organizations through Pennsylvania and New Jersey to provide education to the healthcare professionals as well. And we partner with organizations like the very distinguished organizations that we have here with the same purpose of helping the community. We have received awards through the National Hispanic Medical Association and National Hispanic Health Association. We'd like to distinguish our great members. You know, sometimes people work very hard and they don't get acknowledged. So we like to open those bridges. We like to advocate and have an open voice to address issues like public health and bills that might affect our community and our profession. So thank you very much for the opportunity and happy to be part of this effort.
Thank you, Dr. Ortiz. Thank you for the work that Salam is doing. Thank you for educating our community and for inspiring others to come into the field, to become also physicians and professionals within our community. So thank you for that. And last but not least, I would like to introduce now Paola Maisonet. She is with the Department of Behavioral Health and Intellectual Disabilities. Ms. Maisonet.
Thank you, Hector. Good afternoon, everyone. So DBHIDS, or the Department of Behavioral Health and Intellectual Disability Services, we function as the single-payer public health system for the city, where we oversee the behavioral health care, intellectual disability services supports, and early intervention services. And we're able to do that through a very vast and integrated system where we rely on our networks of providers, our partnerships and collaboratives such as these, and of course, community residents, where our mission is really to educate, strengthen, and serve individuals in all the communities that are in Philadelphia so that we can thrive. Thank you.
Thank you, Ms. Maisonet. Truly appreciate it. So now moving along, one of the things that I would like to do before we start is to talk a little bit about the house rules and how the whole event it will go. So one of the things that we are going to ask you is to utilize the chat to ask your questions. We will be collecting those questions, and as the presentations go, we will try to answer those questions immediately if it is possible. If not, by the end at the end of the event. Also, we will be collecting surveys, which are extremely important, in which you will have the opportunity not only to let us know how effective the virtual town hall was, but also it's a way for us to collect information regarding issues or information that you guys are requesting. So, so please ask questions. Please provide us with your feedback. It is imperative that we get that feedback in order to make this as organic and as flexible as possible. So first, what I would like to do is that well, we're going to be talking about different type of issues. Hopefully, we will not only talk about healthcare issues, but also issues related to PICO and energy, fair housing, family and youth, domestic violence and sexual abuse, public safety, school district issues, issues related to senior services, as well as social determinants that are affecting all our communities. I would like to start with our team of medical professionals in the healthcare industry. And today, one of our presenters, I'm extremely honored to present to you guys Dr. Joanna Vidal. She is the Senior Medical Director in Pediatrics at UPMC Health Plan and practicing pediatrician at Hamilton Health Center, an FQHC in Harrisburg, PA. Dr. Phelan graduated with a bachelor's degree in biology from Wellesley College and received her Doctor of Medicine from UMDNG Robert Wood Johnson Medical School in New Jersey. Dr. Phelan completed her general pediatric internship and residency at the University of Washington, Seattle Children's Hospital, and received a healthcare focused master's in business administration from George Washington University. Dr. Vidal has over 20 years experience in clinical practice and has been a thought leader in the field of value-based care, population health, care management, and social determinants of health. So Dr. Vidal will be talking to us about COVID-19 and pediatrics. Dr. Vidal, thank you very much for being with us today. It's an honor to have you. Go ahead.
Thank you so much, Hector, to Sile and to everybody that is attending today's meeting for your time to discuss the importance of, how do we protect our children from COVID-19. I have a slide deck, Mr. Hector, if you would like to share the slides with the audience. Thank you so much. Next. So today we're going to be talking about teaching healthy habits to children, face covering, social distance, the importance of routine well child visits and immunizations even through the pandemic, media exposure in children, and I'll share some general strategies and tips for families. Next. So it's really important for us to teach children healthy habits to help reduce the spread of germs. And this is something that we need to do over and over again, especially the younger our children are. So we want to teach them how to cough and sneeze into a tissue or the elbow. It's very important that we teach our children and check our teenagers to be sure that they're washing their hands properly with soap and water and that they're washing their hands for 20 seconds. Through the COVID-19 pandemic, in order to stay healthy, we want to avoid children, teenagers, and yourself, parents and caregivers, to have close contact with people that are sick, especially if they have fever and upper respiratory symptoms like cough and runny nose, sore throat. Please, if you are sick or your child is sick, stay home. And regularly clean commonly touched surfaces. And in the home environment, that will be the kitchen and the bathroom. Next slide, please. So face covering is an important way to protect us and protect those that we love around us from getting COVID-19. It is really important that we understand that children over the age of 2 should have a face covering when they go outside of the home environment. But if you have a newborn, a little infant, or a very young toddler under the age of 2, they do not require a face mask. So how do we wear our mask correctly, which is really important? Prior to putting a mask, you want to wash your hands. And you want to be sure that the mask covered the nose and the mouth, and that you secure the mask under your chin. That is going to be the same way for children. Try to fit it snugly across the sides of the face and make sure that you and your child can breathe easily. It is important to explain to children also why are we doing social distancing and what does it mean? Because it's natural for children not to understand that concept. Children like to play and hug and play at the vicinity. So we want to teach them what social distancing is. And that means keep a safe distance, that's 6 feet or 2 meters between you and other people. We also emphasize the importance of staying home when sick and avoiding public places and large gatherings. Limit your contact, again, with sick people, including friends and family members that may have symptoms. Following these guidelines may be difficult for children, and we recognize that, but we know also that social distancing only works if we all participate. I like to emphasize the importance of routine care during the pandemic. Our pediatric practices, family doctor practices are open and providing excellent care for you and your family. Routine well child visits for children is very important in order to be sure that your child is growing, is healthy. We also screen for developmental delays, and very importantly, we update your child with immunizations. Now more than ever, children and teenagers need to continue receiving this care. And the reason why we're very concerned is because at the early onset of the pandemic, there was a significant decrease in the number of preventive health visits at our practices. Children need timely immunizations, including the influenza immunization this season. I want to remind parents of the importance of playing with your child, spending time with your child that does not require media. Constant exposure to news about COVID-19 can increase confusion and anxiety in children. So I highly recommend to limit the use of television and social networks, and don't allow the use of electronic devices at the dinner table or before bedtime. Plan safe activities like arts and crafts, music, board games, or just having a plain old conversation with your children. We are facing tough times as families. I'm myself a parent also with children that are going through online education. It is important that we talk openly, simply and honestly about what's happening. Use everyday opportunities to model and talk about your feelings. Stay connected with family supports and offer hope to your children for the future. Be ready to provide more attention and affection than when needed. Structure the day around a regular routine and find new activities or carve out time for old ones. For parents and caregivers, we need to be reasonable and patient with ourselves. Ask for help and ask for it frequently as needed and accepted. If you have a partner at home, take turns caring for the children, and please be sure that you take time and space to recharge. Emphasize a positive attitude and try to maintain a consistent family routine, which is going to make it so much easier for you and for your children. Thank you.
Thank you very much, Dr. Vidal. Truly appreciate your words of wisdom. I think that this is an extremely important topic, especially for children, knowing now that, this is one of those vulnerable populations that are presenting more positive cases now more than ever. And again, it's very concerning for parents in how you address this, the COVID-19, how you keep them safe. So thank you for that information. Truly appreciate.
My pleasure. Thank you so much. And for everybody listening, don't forget your pediatrician and family doctor. They're a great resource for you.
Thank you, Dr. Vidal. Now, I would like to introduce Dr. Julia Di Joseph. Dr. DeJoseph is the Chief Medical Officer for the Delaware Valley Community Health, where she sees patients as a family physician at Delaware Valley's Maria de los Santos Health Centers, which provides culturally competent, high-quality care in North Philadelphia. Dr. DeJoseph.
Thank you. It's great to be here, and I appreciate this opportunity. Can you guys give me a thumbs up? You hear me okay? Awesome, thank you. So it's wonderful to follow Dr. Vidal. I'm a family physician, and my pediatric colleagues are absolutely essential to my work. Everything she said about pediatric care resonates not only with our pediatric population, but also adults. So I cheated by going after Dr. Vidal because she, the things that she is teaching parents and caregivers to teach their children are the exact same things that we are teaching our adult patients and community members, as well as our staff even in our health centers to do. So hand washing, social distancing, and mask wearing are absolutely essential in the fight against COVID-19. So these are things provided in an incredibly straightforward way that Dr. Vidal taught you to share with your constituents, your family, your community member to work on prevention of COVID-19. I cannot stress that her words were so important in this fight against the pandemic. So prevention and preparedness are the two key things, not only in our work as primary care providers, but also in the midst of the pandemic. So we've talked about prevention. So preparedness also comes as a very important second component in responding to the pandemic. And to be prepared, I really, as a primary care provider, encourage everyone to establish care with a primary care provider. If you're feeling well, it's important to have preventative care. And if you're feeling ill, it's important for you to have a trusted resource where you can go to seek care. Many people are unaware of the concept of federally qualified health centers, also called FQHCs. My organization is a federally qualified health center, and we own and operate 8 health centers in the city of Philadelphia. But there are many health centers across Philadelphia, across the state of Pennsylvania, and across the nation. And one of the greatest things about federally qualified health centers is that we provide care to anyone, regardless of their ability to pay. So while we love people who are insured, because that gives them lots of opportunities to receive care outside of our walls, all FQHCs will have a sliding scale for persons, regardless of their ability to pay. So if people are insured, if they're underinsured, meaning they still have significant copays, or if they're uninsured, they're all welcome at federally qualified health centers. Establishing care with a primary care physician is important, especially as we go into cold and flu season. Dr. Vidal mentioned the flu shot, and I'm sure the two of us would do cartwheels if all of you had gotten your flu shots already. And if not, please go to your primary care provider, contact your local FQHC, or even the local pharmacies like Rite Aid, Walgreens, CVS. They are offering flu shots as well. That is part of being prepared. You do not want to have both the flu and COVID this season. That's a much higher risk situation than having one or the other. Additionally, by protecting yourself against the flu, that will help your provider know how to treat you and care for you if you do develop symptoms down the line. Lots of things can look like COVID-19, but having that long-term relationship, or an established relationship, I should say, with a primary care provider, as well as doing the things that can help keep you safe, are really going to be key. As Dr. Vidal said, primary care offices are open. Currently, our offices, I can speak for, we do see certain patients in office when indicated. And we also have the ability to do telehealth and video health calls, as many of our other primary care offices do, to care for chronic problems. We can help you decide if you need to come in, and we can help you decide if you need to go to the emergency room. Because I know people are afraid and not sure if they should go to the emergency room. And there are some situations where we say, no, you don't have to. And there are other situations we say, absolutely, you have to. Because despite the pandemic, healthcare is still happening and illnesses are still happening. So this is my plug to establish care for a primary care physician in your life. And also to let you know that Delaware Valley Community Health is here. as a primary care provider. Maria de los Santos obviously provides a large amount of care to the North Philadelphia Latino population. And there are many of our sister organizations that do similar excellent work. So that is all from me. Thank you for giving me some time. Oh, you're muted.
Thank you very much, Dr. DeJoseph. Prevention in healthcare is imperative. It's extremely important, and consists on the measures taken for disease prevention, and that's what we're looking for. So thank you for your feedback. It was truly an honor to have you, Dr. DeJoseph.
Thank you.
Now, I would like to introduce Dr. Maria Elena Vega. Dr. Elena Vega, she is a board certified in pulmonary critical care and sleep. She works at the Temple Lung Center in Philadelphia, where she serves a diverse patient populations. For the last 10 months, she has been involved in the care of patients hospitalized with COVID-19, pneumonia, some of whom have recovered and are being followed by Temple University Hospital.
Thank you, Hector. Thank you, everyone, for the invitation. And before I start, I have a few slides, so if you don't mind showing them. But I can't echo or emphasize enough what Dr. Vidal and Dr. DeJoseph said about prevention. It is key to prevent this disease, and all the measures that they talked about will help you prevent the infection. But I'm going to talk to you about how we treat patients with COVID-19 once they're hospitalized. So just so that you know, 80% of the cases are moderate to mild. So most of them can be treated at home with antipyretic medications, and they don't really need to come into the hospital. So as I said, 80% of patients who are infected will have mild disease to moderate disease. However, 15% of patients will develop severe disease where the oxygen level will drop in your blood, and that's because of the presence of pneumonia. So you'll have an infection of COVID in your lungs, and 5% of patients will be critically ill and will require intensive care unit. These patients will present with severe pneumonia and will need high levels of oxygen and may need to be placed on mechanical ventilation or breathing machine. So the patients who are at risk for severe disease are usually those who are older than 60 years of age, if they have heart problems, diabetes, lung disease such as COPD or pulmonary fibrosis, cancer, kidney disease, and also obesity have been associated with severe COVID-19 disease. Next slide. So why do patients with severe disease need oxygen? So what happens in patients with COVID-19, and not all of them, again, only 15 to 20% will present with lung inflammation. So somehow the virus causes an inflammation in the lungs. And when there is inflammation in the lungs, the breathing tubes or the alveoli, like you see here, will fill with fluid. And if it fills with fluid, then you can't breathe. So that's why patients need oxygen. And that's what we call ARDS, or acute respiratory distress syndrome. Next slide. And these are two slides, two x-rays. One, a normal x-ray, so you can see how the dark areas are normal lung. And you can see to your right, a patient with COVID-19 pneumonia. So there are very few dark areas, and that's because the pneumonia or the inflammation has taken most of the lung. So those patients need high amounts of oxygen. Next slide. So currently, there are only two medications that are approved by the FDA to treat patients with COVID-19 pneumonia in the hospital. Remdesivir is one of them. It's an antiviral medication. And dexamethasone, it's steroid. It's a very potent anti-inflammatory medication. Like I said, there is an inflammation. So the idea behind steroids is to lower that inflammation so that the lungs heal, basically. Convalescent plasma is another treatment modality. It's plasma from donors who have recovered from COVID-19. And the plasma of these patients have antibodies to the coronavirus, and it may help suppress the virus and improve lung inflammation. Not all the centers offer this treatment, but some of them do. Next slide. There are multiple ongoing trials for patients with COVID-19 pneumonia, not only at Temple, but in other centers in the country. And patients can enter these trials voluntarily. And the trials are basically there to try to see if a drug is safe, if it's safe, and also if the drug can improve your symptoms. And like I said, this is voluntary, but I think this is key because by participating in these research trials is the way we find new therapies for COVID-19 pneumonia. Remdesivir and dexamethasone were part of trials, so that's how we were able to get approval by the FDA. So if you have patients who are sick with COVID-19 pneumonia, I would encourage you to enroll them in clinical trials if possible. Next slide. And the vaccine, as you know, the COVID-19 vaccine is made using parts of the virus. And the idea behind it is that it stimulates the immune system by producing antibodies exactly like you would if you were exposed to the coronavirus. And that will help patients to be prepared to defend your body against the disease. There are multiple scientists developing vaccines. Currently, as far as I know, J&J has a phase 3 trial with a vaccine for COVID-19 pneumonia. So hopefully we'll have a vaccine by the end of the year, but only time will tell. So this is why I think that preventive measures, just like Dr. Vidal and Dr. DeJoseph said, is key. We have to prevent this disease. Although we have made some advancement when it comes to treatment of this disease, patients can get really sick. Thank you.
Dr. Vidal, I have 2 questions for you. Now that we're in the flu season, how do I know, I mean, what's the difference between COVID and flu? Because it seems to me that it's similar symptoms in each one of them. Or there is something specific that will tell me that, hey, no, this is the flu, this is not COVID. Because again, I mean, I'm thinking about all the families and all the individuals who will get scared and concerned about, I mean, now that there is a flu season, having the confusion between one thing and the other.
So that's an excellent question, Hector. And it is almost impossible as a physician for me to tell the difference when I see a child or a young teenager if you have COVID-19 and the flu. The only way we will know is by doing the testing. And as you may be aware, the testing for both flu and COVID-19 that we use in many of our clinics is actually a nasal pharyngeal swab. So that means it's like a Q-tip that you insert inside the nose, and you send that sample and they check, they do PCR testing. So basically they check for the virus. For those that had the pleasure of doing that testing in children, it is not fun. And so definitely anything we can do to avoid it is really important. If they need it, they need it. But this is where telling the difference between the symptoms of COVID-19, as we know, fever, cough, runny nose, sore throat, and then with children, it presents with many symptoms. It could be a tiny little runny nose and no fever, or you could present with all the symptoms of trouble breathing. Children could have vomiting, diarrhea, loss of appetite, sore throat, ear pain, runny nose, coughing. Now, this is where good hand washing, using the mask, prevention is our key in order to avoid having children sick. And the same way we get COVID is the same way we get the flu. Now, the difference is that we have a flu shot, and it's really important. After 6 months of age, so you can get your flu shot if you're 6 months and older, all the way until adulthood. It is really important for those babies from birth to 6 months. They cannot get the flu shot. So the family members, the grandparents, the caregivers need to get the flu shot to protect that baby. If your child is 6 months and older, it is time for them to get the flu shot if they haven't received it yet.
Thank you. I have another question from Kelly Spellman. Are those with the condition of AERD, Samster's triad, at risk for COVID also?
Can you repeat the condition again?
Are those with the condition AERD, Samster's triad, at risk for COVID also?
Is that an adult condition? I'm so sorry. Dr. De Joseph, I'm going to ask for help because I haven't heard AERD. Maybe end-stage renal disease, I'm kind of thinking.
Yeah, I'm not sure. Or is it in response to ARDS, which is acute respiratory distress syndrome? I'm sorry, everyone. Now you're part of a full medical discussion. So I'm not sure if that's what they were referencing, which is what can happen in the ICU.
AERD.
I think we're talking about Samter's triad, asthma, sinus inflammation with recurrent nasal polyps, and aspirin sensitivity. AERD, aspirin exacerbated respiratory disease.
I mean, I think that's a very, very specific question and more of a rare condition. So I think you could lump that in. Thank you for that clarification, Natalia. You can lump that in with asthmas, with anyone with chronic lung disease. So yes, people with chronic lung disease are at increased risk for any respiratory infection, including COVID and including complications and death from influenza. So yes, that is a higher risk situation. It is not a death sentence, but it is certainly higher risk. And so it's important, again, to just do the right things with prevention and preparedness. But certainly, yes, can be a higher risk.
Thank you, Dr.
Well, Hector, I just wanted to quickly say that you do not need a medical condition to be at risk for COVID-19.
Exactly.
So, yeah. So like if you have it, even more careful, but I will be careful regardless if you have or not any medical condition, because you can develop acute respiratory symptoms and be very sick from it, even if you have no preconditions.
Exactly. Yeah. So it is, that's what we're seeing when young teens right now in like September, we're getting it more frequently. It's because they thought they were healthy and they couldn't get sick. And that's not completely true. They can get sick. They can get severely ill. And even just older healthy adults can get sick and severely ill and die. And what's more, they can pass it on to people who are at even higher risk for death, which has been people with worse chronic disease and with older age. So the risk factors are additive, but there's no rule that someone who's 100 with lung disease will die and that somebody who's 20 and healthy won't. Unfortunately, COVID doesn't seem to care, which is why prevention for everybody is essential.
Thank you. Thank you very much, Dr. Vidal and Joseph. Now, I would like to introduce Rebecca Pfizer. She is a nurse and works for the Philadelphia Department of Public Health in the Division of Disease Control as a communications outreach coordinator for the Public Health Preparedness Program. Ms. Pfizer?
Thank you so much, Hector. So this will be a very quick, packed presentation about health guidance and resources, specifically about testing and contact tracing from the Department of Health. And real quick, just because I see so many service providers here, there are 2 RFPs open that are designed to support organizations who are already trusted by communities more severely impacted by COVID. They're designed for those organizations to become testing sites or support isolation and quarantine. If any service providers want that information, feel free to reach out. I'm happy to pass it on. Next slide. Or any slide.
So we weren't able to get access to the slides, but we do have the handout that we're going to be emailing out later after the presentation. And maybe you could tell them a little bit more about the handouts that you have.
Sure, not a problem. So I'll just go through it a little more informally, and then if there's any questions, just let me know. So the handout that you're talking about is a wonderful set of resources that were developed with the Pennsylvania Health Law Collaborative. We've been working with them. They've done a lot of research into the specific testing sites that are more accessed by folks that may not have insurance, may not have documentation to work in this country, may not have English as their preferred language. And so there are a set of flyers regionally based on where they are in the city, and they get into a lot of detailed information, not just about what to expect and how to get your results, but also which languages are actually available and easily available, information about insurance status, migration status, and your rights as a worker. So I can go over some of that information. Really what's important to know is that all COVID testing and treatment should be free, even if you don't have insurance. If you do have insurance, it should be covered, though there may be a very small copay. Additionally, testing should not affect your migration status, and you do not need a photo ID. Testing should be confidential. You should not be asked about your migration status. Testing sites will need ID only to match your results, but your actual ID should not be shared outside of that clinic or testing site. Patients should not be turned away from a testing site if they don't have ID. You can say that you don't have an ID and they should still test you. You don't need a driver's license. It doesn't need to be a photo ID. Municipal IDs, passports, and like I said, no ID is also acceptable. What else can I tell you? Let me go back here and see what else is important to add. So to take a quick step back, if you don't feel well and you have mild symptoms of COVID, what you need to do is stay home, rest, and avoid contact with others. That can be a lot to ask if you share a home with other people, especially if you share a home with people that are kind of outside of your family. So if you want more information about that, we can share some guidance around that for folks that are living in shared housing. First thing to do if you don't feel well, of course, call your doctor. And if you don't have a doctor, follow Dr. DeJoseph's advice to establish care with a primary care doctor, even if you don't have insurance. So one resource to let you know about is the Health Department helpline, the COVID helpline. That number is 1-800-722-7112. It is staffed by health professionals. So this is a number where you can find information. You can call them and ask them, do I need to get tested? This is what I'm experiencing. What do you think? It is better to talk to your doctor first. It's way better to do that. But if you don't have one or you want to get a quick answer, you're welcome to call. They can also tell you where to get tested if you would like to know, and other city resources that are available for folks coping with COVID. So there is a website. It's actually a pretty easy to use website from the Department of Health, phila.gov-testing. It's interactive. It's very easy to use. It's translated into 6 languages. And you essentially just click on the area that you see in your neighborhood and it opens up very basic information about COVID testing sites. The flyers that we can give you later have way more detail about some of these same sites that are, like I said, more accessed by some folks in the community. So I will go over contact tracing quickly. So if you do, despite your best efforts for prevention, if you do test positive, you should be contacted by the Department of Health for contact tracing. So contact tracing works to slow and stop the spread of a disease. It involves identifying people who have an infectious disease like COVID and their contacts meaning people who have been in close contact with the person who's tested positive. And what that means is essentially you've been within somebody's shared space for maybe more than 15 minutes without a mask, without precautions, and you are more likely to have contracted the disease that way. So contact tracing staff will counsel people who have the virus and their contacts about any risks specific to their health and the need to quarantine or isolate or stay away from other people. They will check in with you more than once to make sure that you have the resources and the information that you need to recover from the illness and to protect the people around you. So participation is of course voluntary, but this will help to stop the spread of disease and will help to save other people's lives and will help to have help the city understand how to best fight this disease. Contact tracing is how we know, for example, where to send mobile testing sites, what area of the city is having a rise in cases, where do we need to have more attention paid. where to do more presentations like this, for example, so people that are most at risk of COVID are getting the correct information. So I will also share a flyer about contact tracing that gives you the same information that I'm saying. So I know I'm going fast, but it'll be there for you afterwards. Just to reassure people, how do you know when the Department of Health is calling you and it's not spam? So the health department will only call you from a number starting with 215, 218. That's the number that you know will be a contact tracer reaching out. They will only text you from a number that's starting with 833 or 855. And some more information just to reassure what the process is like. Contact tracers and case investigators they are not allowed to release information to law enforcement agencies, including ICE, and they should not ask about immigration status. Another important piece of information is they will not tell a contact who gave their information. So for example, if you test positive and someone says, who have you been in close contact with in the amount of time? And you may say, well, my neighbor, and you give their name and their phone number. The contact tracer will call your neighbor and they will tell your neighbor, someone you have been around in the last certain amount of days has tested positive for COVID. They will not say who, they will not say where they got the number from. Additionally, contact tracers should not ask you for your social security number or any information like credit card information or bank account information. And the last piece that I think is important is that the Department of Health kind of waited to hire people that represented the diversity of Philadelphia. This is known because we're asking people very personal information about like where they go, who they see. It's, nobody really wants to share this, we understand that. So contact tracers have to be sensitive to the needs of the people that they're interviewing. So you should be able to speak to a contact tracer in your language. And they try to hire contact tracers who represent the same racial, ethnic, and linguistic breakdown of Philadelphia, so proportionally. So approximately 1/3 of contact tracers are first-generation college students. About a quarter speak more than one language, and about 1 in 7 of those folks are immigrants themselves. So looking forward to hearing from any of you during the Q&A. We actually take your questions very seriously, and it helps us know where to target efforts and where to put our energy into. So thank you so much. That's all I have.
Thank you very much. I have a few questions, but for the purpose of time, we are going to move on with the next presentation, and hopefully we will be able to answer all your questions regarding a vaccine, services available in Spanish, and barriers that we are encountering in our communities to make the vaccine accessible for the communities. So we are going to, again, we have your questions. We will be asking these questions to our professionals. Bear with us, and hopefully in our Q&A section, we will be able to provide you the information that you're seeking for. So now, thank you very much, Rebecca. Truly appreciate your information. Now, I would like to move with Lourdes Hernandez from PICO. Lourdes is the Senior Community Engagement Specialist, and her department works to educate customers and providers to access PICO programs and services to assist customers with utility needs. With this current pandemic, PICO has developed and adapted innovative ways to continue to bring this important information to their customers. In addition, PICO has built strong collaborations with key community leaders and service providers to ensure their assistance programs reach vulnerable populations throughout PICO service territories. So, Ms. Hernandez, thank you very much for being with us.
Thank you. Thank you for inviting me. I believe I have a presentation. If not, I can proceed without it.
Just 1 second.
Sure.
Good to go.
All right, thank you, Hector. So good afternoon, everyone. I first want to thank the Coalition of Culturally Competent Providers for inviting us to speak at this important forum. This has been a very difficult year for many of us, and as a result, we've had to learn to adapt and be resilient and to find innovative ways to connect with our customers. And this forum is one of the ways. So again, thank you for inviting us. At PICO, we have made assistance available to all our customers who are having trouble in managing their utility bills during this time. Since the beginning of this pandemic in mid-March, PICO has put in place numerous consumer protections to help our customers. And again, these protections are for any residential customers, not just our low-income customers. Specifically, PICO voluntarily suspended terminations and ceased all credit and collection notices. We suspended charging late payment fees for customers who weren't able to pay their bill on time. We offered restoration to all customers who had no service when COVID began, and we waived all reconnection fees. We are offering COVID-19 payment agreements to residential and small commercial customers, even if the customer is not eligible for an agreement. And these agreements can range anywhere from 2 months to 24 months. And it's a great way to manage those arrearages that have been built up during COVID. We have waived deposits to both new connects and delinquent accounts. We have not removed any customers from our CAP program for failure to recertify. And when you are on our CAP program, you have to recertify every 2 years in order to stay in the program. But since March, we have not removed any customers. And we have sent reminder emails to all customers who were behind on their bill and have encouraged them to inquire about the assistance that we are offering. Next slide, please. So in addition to the consumer protections that I mentioned right now, PICO has a comprehensive portfolio of assistance programs for vulnerable customers. Customers can visit our website at www.pico.com to get information about these programs, including you'll get information on the eligibility requirements and application information, or they can call our general number 1-800-494-4000. I'm just going to name 5 of the programs that we have, but I'm going to expand on 2 programs because they're very important. So CAP is our customer assistance program, and this program provides eligible customers with a monthly credit. LIHEAP is a federal grant program for income eligible customers, and this program provides cash assistance and weatherization. MEEF is our hardship fund, and basically this program helps customers whose service has been terminated or is in threat of termination. Of course, that is not happening now, but again, it's available, should the moratorium lift. LIHEAP is our low-income usage reduction program, and this program provides energy audits, and this is all free, and measures based on those audits to help customers reduce their energy usage. And along with that program, we also provide education on how to conserve energy. And then our last program is our CARES program. And this program is a referral and evaluation program. And what it does is it provides one-on-one assistance to customers with with special needs or extenuating circumstances, and then refers customers to non-utility related assistance so that this will create disposable income that will then allow customers to address their utility bills. Next slide, please. Thank you. So as we know, this pandemic has had an impact on household income as a result of job loss, furloughs, and business closures. Customers have been really impacted. And customers who were not eligible for our assistance programs before, prior to COVID, are probably now eligible now due to their new financial circumstances. So these individuals are what we call the newly identified eligible customers. And in fact, many of these customers are not even aware that this assistance is available to them because they never needed it before. If you were to contact PICO, they would be surprised to find out that they are in fact eligible for these programs. And one of these programs is a very important program, and it's our CAP program. As I mentioned earlier, customers who are on CAP receive a monthly credit based on their household's total gross income and their annual energy usage. But most importantly, one of the benefits of CAP is that when you first enroll in the program, any customers are eligible for what we call pre-program arrearage forgiveness, or PPA. And basically that means that any delinquency on the account is set aside for forgiveness. Now this delinquency can be in any amount. It could be $500, $5,000, $10,000. Once that PPA is set aside, what the customer is now paying is just their current bill. And this bill may include their credit. Every time the customer pays their bill in full and on time, 1/12 of that delinquency that was set aside gets forgiven until the entire balance is forgiven. So again, this is a great way to help customers address arrearages that have built up during the pandemic. The other thing that's important is that when a customer contacts us and provides us with their financials, we know that they exist and we can target them for other assistance programs. Next slide. And the last program I just want to highlight is LIHEAP. And as I mentioned, LIHEAP is a federal grant that provides households with assistance during the winter months. The program opens November 2nd and runs through April 9th. Customers can get a LIHEAP cash grant up to $1,000 per household. You know, during the spring and summer, especially during COVID, the federal government offered assistance, and they actually offered customers up to $800 of eligible grants for eligible customers. And unfortunately, many customers did not take advantage of that. So a lot of that money went back to the federal government. So because we had some monies that were not used, LIHEAP was able to increase their crisis grant from $600 to $800 per customer. So basically, a customer who is eligible for LIHEAP can receive up to $1,800 in free assistance towards their bills, especially during the winter months. So again, this is really important that we encourage our customers to apply for LIHEAP. Again, it's free money. For the LIHEAP regular grant, the cash grant, you don't have to have a delinquency. You don't have to be delinquent to apply. Customers can apply online through Compass, or they can drop off their applications at the county assistance office. All of the offices have drop boxes outside of the office. They also have boxes where they have applications if the weather permits, so customers can get an application. Right now, the county assistance office, and for Philadelphia, you know, that would be the office at Sedgley, 1348. They are not seeing any customers. So at this time, if you need to speak to someone, you'll have to call them. And then finally, what we're encouraging customers is just to pay what they can on their bill, even if they cannot pay the entire balance. What we want to avoid is having customers, again, build up a large delinquency that's going to make it difficult for them to manage their bills. And finally, call us, call PICO and let us know that you're having difficulty paying your bill. We will let you know about all the assistance that is available to you. And it will be based on your individual circumstance. So again, there's a lot of information and assistance out there. We encourage customers to call us. PICO is here to help. We care about our customers, so please contact us. Thank you. So that's the end of my presentation.
Thank you, Mrs. Hernandez. Truly appreciate this information. It's extremely important for those that are participating to know where to call, where to reach, especially in PICO. You're right. I mean, these are harsh times for many individuals and families across the city and across the state. So it's always good to know that we have PICO as one of those community partners that are helping us to improve the quality of life of all those that lived in our communities. So, Ms. Hernandez, thank you very much.
Sure. Thank you for inviting us.
Okay, now I would like to introduce Angela McIver. Angela is the national leader and advocate for fair housing for all. Angela, I'm sorry, I have dogs going crazy at the door. I apologize for that. Angela joined. Those are my little ones. the Fair Housing Rights Center in the Southeastern Pennsylvania in 2007 as Chief Executive Officer. In 2016, Angela was appointed to the U.S. Commission on Civil Rights. In 2018, she was elected to the board of the National Fair Housing Alliance. And in 2019, Angela was designated the National Housing Fellow of the Congress Commission. Angela delivers housing commentary and on radio, television, and print media. Angela, it's a great pleasure and an honor to have you with us this afternoon. Thank you very much in addressing such an important issue, especially now in Philadelphia.
Thank you so much. I want to say deeply grateful to the coordinators of this event, to the panelists, and to the guests. It's a pleasure to be here, and I'm really excited to talk about fair housing. So let's get started with the slides. Awesome. So oftentimes housing isn't discussed. So again, I'm really excited to be able to talk about housing today because it's at the core of our lives. We know that housing determines so much about us. In fact, the zip code that we live in many instances contributes to our life expectancy, as well as the quality of life that we live. So today I'm going to talk about using the Fair Housing Act during the COVID-19 pandemic. Next slide, please. The Fair Housing Rights Center in Southeastern Pennsylvania was organized in 1990 and incorporated in 1992. And the mission of the organization is to ensure equal access to housing opportunities for all people. And I want to underscore the importance of opportunities because we know when we live in areas where we lack opportunities, we will see all sorts of social problems in those communities. So our goal is not only to address individuals that are dealing with housing discrimination, but also communities that's battling housing discrimination. And how we go about achieving that is rather lengthy, and I'm just going to mention a few things. We educate the community, we audit practices of the real estate community and related industries. We advocate at local, state, and federal level for good housing policies. We contract with housing providers to ensure that their compliance is on point with fair housing laws. And we offer information and referral when people have reached us and we're not able to assist them. I also want to mention that the Fair Housing Rights Center is a qualified fair housing enforcement organization, meaning we have a contract with the federal government in order to investigate and help people file claims. We do not charge the public for those services. And in fact, before this session started, I was negotiating back and forth on behalf of someone who's now conciliating because they filed a complaint and they're having their moment to seek social justice. Can we advance? Thank you. I like to ride around wherever in the service areas that the organization assists and take photos because a picture says 1,000 words. And in this instance, the intention was not to capture anything deplorable, but rather just capture the conditions of our neighborhoods, because there is a story behind why our neighborhoods look the way that they do. Next slide, please. And we can attribute to the conditions in Philadelphia this redlining map that you have in front of you. This map dates back to 1937. And it was created by the Homeowner Loan Corporation under the Roosevelt administration. And their goal was to help homeowners that were underwater, about to lose their homes, insure those homes by insuring the mortgages. And when they did so, they created a coloration system. You see green, blue, yellow, red, and each color stood for something. Green meant best, blue meant still desirable, yellow meant declining, and red meant things like dangerous, hazardous, or risky. And if you concentrate on where the red is on this 1937 redlining map, and we overlay today a map of Philadelphia, we will see that not much has changed. The same areas that were excluded or discriminated back in the 1930s are also discriminated to this day. Thank you so much for advancing. Because I was able to pull from the city of Philadelphia's fair housing assessment that it was done back under the Obama administration. It is no longer a requirement under this presidential administration, but under the former presidential administration, neighborhoods, or pardon me, jurisdictions that receive community development block grant funds had to uncover where there were racially and ethnically concentrated areas of poverty within its jurisdictions. And you will see the magenta outlines, and within those outlines, the shading that goes from lavender to deep purple identifies the concentrated racially and ethnically areas of poverty in Philadelphia. And in a lot of instances, what you saw on the previous slide, you don't have to go back, looks the same that you see in front of you right now. And I have this available for Blacks in Philadelphia as well as for Hispanics in Philadelphia between 2010, 2014. So it's very important that when we get federal money, particularly the community development block grant funds, that money is triaged into the communities that need it the most. Can we advance? Thank you. From the time that those homeowner loan corporation or redlining maps were created, in which the federal government was the reason why we received those maps, and practitioners like banks, insurance companies, and realtors also use those maps to segregate or steer certain groups into the red, green, blue, or yellow areas and keep others out based on, you know, your racial identity, ethnicity, or religion. It went from 1930s up until 1968 when the Federal Fair Housing Act was passed on April 11th, 1968. And if you pay attention to the first bullet here, you see that after the assassination of Dr. Martin Luther King Jr. on April 4th is when the Federal Fair Housing Act was passed 7 days later. So in the fair housing movement, we attribute much of our work to Dr. King's devotion to housing fairness that he and others did in 66 and 67 in Chicago and in communities throughout Chicago, bringing the media into those areas to highlight the disparities in housing that were occurring back in the 60s, and unfortunately that we still see happening right now. So just note that when the act was passed in 1968, there were only 4 protections: race, religion, color, and national origin. Gender was not covered until 1974. So if you're from a household or a family where you wonder, why didn't, you know, mom, auntie, grandmom, or, you know, my sister buy a home until after 1974? Well, that's because women were not allowed to access credit through the banks until the Equal Credit Opportunity Act was passed in 1974. And then it wasn't until 1988, 20 years after the first Federal Fair Housing Act was passed, that it was amended in 1988 to include disability and familial status. And we're going to talk more about what that means in a few moments. But now we have a total of 7 protections. Yeah, there are 3 pictures altogether. And you see a progression here of Dr. King and his relationship with President Johnson and trying to deal with housing fairness, because the president wanted to pass the law sooner than Dr. King's assassination, but Congress refused to comply. And it wasn't until April 11th, 1968 that the law was passed. And then you see the widow of Dr. King, Coretta, standing next to President Reagan when the law was amended in 1988. Please advance. And essentially, can we go back? Thank you. Housing discrimination means treating a person or group of people differently. And it's, you know, when they're applying for housing, in the housing, or when they're trying to leave the housing. Please advance. Here's some examples of different forms of housing discrimination. And I mean, these are real examples here. We're not making this stuff up. It can be intentional. And that's when you might hear somebody say something like, we can't rent to you because you have children. Now, they don't always tell you that nowadays, but it could be in the policy. They may have a no kids policy, or they may treat children different. For example, there may be a policy that no children can get in the pool after 7 p.m. or there has to be quiet hours or things of that nature. If there are children around and you see rules like there has to be a quiet hour, oftentimes that's targeted at children. The problem with that is that it singles out children. It's treating families with children different than people that don't have children. Disparate impact, it's more formal definition means a neutral policy on its face, but when applied has a differential impact on people. Well, here's an example of that. Our policy begins with a minimum loan amount of $50,000. So anybody that has a home under $50,000 is excluded from accessing this benefit. In the case of steering, I even had this to happen to me decades ago when I was looking to purchase a home. The realtor literally said to me, "I know the perfect neighborhood for you." I went to look for a home in one neighborhood and he said to me, "I know the perfect neighborhood for you." And then there's the refusal to allow reasonable accommodations or modifications for people with disabilities. And an example that we have seen before COVID play out time and again has been, you can't have a service dog here. You have to pay a pet fee if you have a service dog or a support animal. And if you have a service dog, it is not considered a regular pet. It is actually an animal that performs a job. It mitigates a disability and performs a service. The same way with a support animal. And when you have a support animal or service dog that you have gotten permission to have in your home, then you are not supposed to pay a pet fee, period. And if it happens, you should report that. And now that we are amid COVID, we are aware of immediate medical related conditions under COVID, but who knows what we will uncover as science learns more about the long-term effects of COVID. With that said, people may be able to use the reasonable accommodations and reasonable modifications provisions of the Federal Fair Housing Act to stay in their home or change something about their home, or to be released from a lease if they have a lease, because the home is no longer servicing them. Because when you're applying reasonable accommodations or modifications, you have to show a nexus between the medical condition and the need to change something in housing. And if you can do so with the help of your medical provider, a social worker, or a party who's in a position to know a lot about your medical condition, you should be able to request the reasonable accommodation or modification. And if it doesn't happen, I suggest that you report that. You can report that with the Fair Housing Rights Center. And then something that has been on the rise for quite a while, but we're seeing more of right now under COVID, and that's sexual harassment. So there's different types of sexual harassment. One could be the hostile environment, where maybe you're putting up with people saying things to you like that they shouldn't. For example, "Oh, how you look today. You look great in that." And I enjoy watching you, that kind of thing. Or it could be something like, "If you give me," and you can fill in the blank, "then you won't have to pay your rent and I'll fix your repairs." We're seeing a whole lot of that. And HUD and the Department of Justice, which are both two federal agencies that are responsible for enforcing the Federal Fair Housing Act, have an initiative that they've joined forces on, and they're really enforcing the Fair Housing Act as it relates to victims of sexual harassment. Next slide, please. Like more pictures will pop up. And, just note that race is a construct, but still we live by this thing. So you see that we have different types of races. Color can fool you. People can look one way and be something else. Religion, there's a picture that's not showing up, but it really is one of interfaith. And then national origin, how that can look various ways. And you can be born here, but because you look like you come from somewhere else, you could very well be mistreated or denied housing. Gender doesn't have to be a female, but it can happen that way. And then disability can be physical or mental impairment. And then familial status, that could be a single mother, an expecting mother, a family with children under age 18, or people who are adopting and foster parents. Next slide, please. Why is this important? You can advance to the next slide. Because in 2018, as an example, if you're able to see the figures, HUD has 10 regional offices, and you can see all of the complaints that were filed with HUD. That excludes the offices that were, or the complaints that were addressed on the state level, because there are offices known as Fair Housing Assistance Programs, and they take care of those complaints on the state level. Pennsylvania's Fair Housing Assistance Program is the Pennsylvania Human Relations Commission. But you're looking at members of the National Fair Housing Alliance and how often they had filed complaints in 2018 with HUD's regional offices. And we are in Region 3, that's the red section, and there were, or it looks like the orange section, pardon me, and it looks like there were a total of 675 cases filed. And the Fair Housing Rights Center is part of the number that you see listed there. Next slide, please. If you are inclined to file a complaint, do so because of fair housing discrimination, even fair lending, because that's covered under the Federal Fair Housing Act. Fair lending is when you are denied access to credit when you qualify for it. Philadelphia was part of a huge journalistic investigation that was released in February of 2018 by the Center for Investigative Reporting in the publication Reveal, in which it identified that folks who had applied for conventional loans around the country, there were hundreds of millions of applicants, but it turned out that 61 metropolitan areas showed a high amount of discrimination. And out of the 61 metropolitan areas, Philadelphia came in #1 because the discrimination on the basis of people who were applying for conventional loans was 3 times that of denials compared to other areas around the country. So Philadelphia, got a lot of attention back then. It continues to, because of people who are being denied access to loans who look like they qualify when you compare them to their counterparts. Before ending the presentation, you see my contact information, but I also want to mention that an important part of the work that we do involves working with what we call testers. Testers are really important people in our lives because testers agree to be paid by the organization to take on assignments. And the payment is part of it, but it shouldn't be the pure motivation for the work. The motivation should really be because you're driven by social justice. And what you do is take on the profile of a real victim who's actually contacted us, who's experienced alleged housing discrimination. In order for them to prove that they have been discriminated against, a tester will expose themselves to something in the industry to see if the same thing happens to them. And if so, that evidence is then used to make sure that whomever that actor was will have to correct their conduct, pay damages, get training, and all sorts of corrective things that they'll have to do in order to stop their discriminatory practices. We've only had a Fair Housing Act for 52 years. It's time that everybody gets on board and stop discriminating. Because if you think back to the photo that you saw after the beginning of the presentation, you'll note that we have these marginalized communities, not because they happen happenstancely, but because they are on purpose. Thank you so much.
Well, Angela, thank you very much for bringing attention to those important issues, especially now for families and individuals that have been waiting for fair housing for many years. Now we have the opioid epidemic, and it seems like priority has been given to other groups. And this has created great concerns across all communities here in Philadelphia. Thank you very much for your work. It's very needed. And again, those who have more questions regarding fair housing, you have Angela's information. I encourage you to get in contact with her. It's another tool that we have in order to help people in our communities. I'm going to keep encouraging participants to ask your questions through our Q&A room. We will answer those questions live. And also, to all panelists, we are running a little bit behind with our time. So please, I will truly appreciate if you are able to stay on time and being able to provide us with, with all the information that is necessary within that 5 minutes. Thank you very much. Now, I would like to introduce from El Concilio, Ms. Yanesa Rivera. She's the Deputy Director at Concilio. Ms. Rivera is the newest appointed Deputy Director For Concilio, since August of this year, she holds a bachelor's in sociology and a master's in professional counseling, and over 15 years professional experience in human and behavioral health services, both within the nonprofit and government sector. Ms. Rivera, thank you for being with us and representing Concilio, one of the oldest, or if not the oldest, nonprofit organization in North Philadelphia for Latinos.
Yes, thank you. That's actually my introduction. Thank you for having me. Once again, I'm the Deputy Director with Concilio, and Concilio was founded in 1962, so does make us the oldest Latino organization in Philadelphia. Our mission is to cultivate the strength and resilience of children and families, improve the quality of life in our community, and maintain the community's heritage, history, and culture. And even though that has been our mission year in and year out, and the pandemic has hit our youth and family and the community during this time. So more than ever, we did our best to get together and continue our mission, even despite the barriers, the boundaries that were put upon us, and was to protect the needs of Philadelphia's Puerto Rican and Latino communities. And as time has gone by, of course, we had the surrounding communities and all of the residents within our communities outside the Latino population. Our core value is really just to improve the quality of life of the community and any resident within the community by working with community partners, local stakeholders, government, and other agencies, educational institutions, just to make sure that we do everything that we can do, and for the things that we can't do, organize with someone who specializes in that to make sure to fill in the gaps in our community. So within the agency, we have two main departments. I did submit some slides. I don't know if you have them available, but if not, it's okay. And I will be pretty rapid and condensed. So within our agency, we have two departments. We have a family social services department, and we also have a community-based services department. Our family social services department provides general training to individuals who are parents or guardians, and they need just general training on parenting. But we also provide resources for those who are interested in becoming foster parents, or like we like to call them, resource parents. And we also provide CPR training in the community. We are also a foster care provider, for those of you who may not know, and we also focus on adoptions and permanency in the family social services department. So within our department, we have seen a lot of challenges during the pandemic, right? The courts are closed. Due to the courts being closed, we have delayed the reunification of families. So the children that are in foster care, the goal is either they reunify with families or they become adopted. And we have seen a decrease in that because the courts were closed. And so you have children that have either stayed in placement longer than they should have, or, you know, the inability to adopt quickly because the process has been slowed up. Temporarily, for the children that are in foster care, a lot of children still have visitation available with their biological parents. And because of the pandemic, visitation was temporarily stopped. It has started since then recently, but it was stopped for majority of the summer. The training that we have provided training on site, off site, during the day, during the evenings. We would accommodate on the weekends, and just working with the partners in the community, whether it was CPR training or the parenting resource trainings. And those trainings, unfortunately, we are unable to do them on site. And getting your CPR skill sets, whether you're a professional that needs it, our own employees, or you are a resource parent, that the process to become a certified foster parent, we haven't been able to do those trainings live, and that has delayed certifications and renewals. So those were the things that and has affected Concilio's ability to help the families and youth within that department. But what we have done to continue to serve the community despite that is we have continued our trainings virtually. We are even able to provide CPR training virtually. And we've been working with the Red Cross extensively, is good. So we not only are able to provide trainings virtually, but we could even do the skills testing virtually. So that is something we offer to the community and our resource parents. We continue to provide the resource coaches, which our resource coaches that work with the resource parents, which are the foster parents and providers. We continue to manage caseloads and keep in close contact with them, despite not housing visitations have been suspended. We talk to them via, video call, phone calls. We still continue contact with them, providing them all the resources and referrals necessary. Continuing to provide updates regarding the courts, what's going on with the courts, and just being that buffer or that liaison for them, letting them know the new updates within DHS, the city, or anything going on, and all of the resources that and tools that are available to them during this time. And just continue being a strong community-based services, which is the other department that we have within Concilio. Within the community-based services department, we offer programming to victims who have witnessed crime in the city of Philadelphia. We have summer camp. We do summer camp and summer programming. We have after-school programming, and we also are big, and we're known for our community events and advocacy events and engagement. So the way the pandemic has affected the Department of Community-Based Services is, once again, the courts are closed. Crime rates may have decreased 30%. However, the pandemic. So some statistics that 80 gun crimes or shootings is a month, right? And so there has only been 2 times in the last 13 years where we have had a month where it has gone over 180, okay? So it was in 2006 and 2011. So 180 is really just the bench. Fortunately, I want to report that from May through August, we exceeded 180 every single month. In May, we had 184 shootings. In June, we had 201. In July, we had 215. And in August, we had 275, which is a big, big change. So even though you see simple assault rates and other crimes going down and they have decreased 30%, the gun crime, the shootings have increased drastically. And the other issue is that the courts are closed. So it's very important to have services like ours, the victim witness services, still standing, even though we're remotely, because we provide assistance to these victims. We provide emergency assistance to them. We provide relocation assistance to them. When the courts are open, we do go and we're advocates for them and we accompany them within the court dates. We have submitted to be an approved preliminary hearing site, meaning when the courts now are deciding to do virtual hearings, we will be here on site opening our offices to those who need to do virtual courts so we can accompany them that way. Other effects of the pandemic is, and I know we have a provider that's going to talk about domestic violence, but as we know, domestic violence rates has increased due to the victims being isolated in the homes with their abuser. In-person programming have been suspended. So as we all know, the Philadelphia schools have closed and all instruction are done virtually. That made a big impact on our summer programming and our after school programming and what we are able to. Though we had those barriers and challenges during the pandemic, we continue to serve the community. We are not officially open to the public, but we come in and we work in staggered schedules and we provide all services remotely. So our victim witness services unit continue to have staff that are on call daily to provide them the emergency assistance and assist them with the relocation despite not being on site and at our offices. We have turned all of our youth programming virtual. So we had virtual summer programming, Last year for the spring, we did virtual after-school programming. As the fall has kicked off, we continue to offer virtual after-school programming. We actually were approved by our funder to provide on-site programming for after-school high schoolers. So we are doing that, which is great. And hopefully by the end of November, we'll be able to provide a hybrid programming for after-school moving forward for after the holidays, have a little bit on site and a little bit virtually, because the reality is there is a lot of challenges and barriers just doing virtual schooling throughout the day. So, you know, the kids kind of get burned out, you know, just like adults. We're zoomed out, the kids are zoomed out too, right? So we're trying to be creative and do different things with the funding dollars that we have in our collaborations to really help the families that are overwhelmed with the virtual community and this. And as far as our community events, advocacy and engagement, we continue virtual Hispanic celebrations. We've done voter registration using safety precautions on site. We have a trunk or treat this Saturday coming up, and you know, it's going to be a drive-through trunk or treat. So we continue to still provide community events and advocacy and engagement to the residents of this area, into the community during this time, even though the pandemic really has made it hard for us to be a staple how we've always been. Most people that know Concilio know us because of our events. So it's hard to not be out there and be the face how we usually are, but we just have done what we could with the times.
Okay, Ms. Rivera, thank you very much for that information. Thank you for addressing those issues regarding families, youth, and children in our communities. And of course, I mean, the aspect of domestic violence and the toll that is taking in our families, our children, and our communities. So thank you for that work. Truly, truly appreciate it. I mean, you provide me the introduction for our next presenters. We are going to have Ms. Cristina Perez from WARD, as well as Teresa White. Ms. Perez is currently the Community Outreach Director at WARD, the Philadelphia Center Against Sexual Violence, and also an independent consultant. She's a national leader recognized by the RWJF Ambassador of Resilience in Latin America and the United States by UNAM University. She has an award for PCAR, Judy Pinto Advocate Work, Pennsylvania Commission on Crime and Delinquency Advocacy for Victims of Sexual Violence. She's also belongs to the International Mujeres Jaliscienses immigrant category, currently alternative on her profession as a consultant, and to the University of Drexel Public Health School in research of Hispanic communities and the impact of syndemics. Ms. Teresa White Watson is the Director of Education and Training at WARD. Teresa oversees WARD's prevention efforts. In her 20 years of experience, Teresa has assisted schools, professionals, and community organizations in their efforts to assist individuals and families to reduce the risk of sexual violence and family violence. Welcome, Ms. White. Welcome, Ms. Perez. Thank you for being with us. So the floor is yours.
Unmute, Christina.
Thank you. Good afternoon, everybody. Well, let me just introduce the services that we have in the community. WARD Philadelphia Center Against Sexual Violence, because we changed the name. We continue to provide services about sexual violence to residents, business we have the 24-hour hotline that is available for any community in Philadelphia. We continue to offer services about counseling services for victims of behavioral rape, and then we continue to have a support group But we changed a little, we modified a little services because for the pandemic, but we addressing more issues in reality in community outreach. You know, before the pandemic, we have the extension to go to the communities to see the realities over there. But right now we have adaptation of services in the community, especially because we have new realities to facing for us. With different situations, with the families, with the kids, with all the communities, you know. The sexual violence is a big situation, problematic situation in the community. From 35 to 45 increase phone call in war by victim survivor of rape or sexual violence or sexual harassment. That is a lot phone call that we receive now just for we continue to provide the services for men. We have a support group for men. That is a new project. It's a new program for healthy masculinities that is very important, and we continue working with the police department too. And then we have a special program with all the health center in Philadelphia City that we try to conduce with them a special project, a special program to ask to the victim, to ask to the client or patient about the reality if they confronting sexual violence. I think so that is very important, not just for health centers, but it's very important for the providers of mental health to asking the question like routine of the therapy session or something like this, because we know that the sexual violence increase a lot. You know, as you know, the 95% of the cases of children's and sexual violence is happening home. And right now is a difficult situation because so many families, they are in shock, they are in poverty, they are in confusion, they have so many issues that sometimes is very difficult breaking the silence and looking for services and looking for solutions. But right now we develop new programs that is new because, like, for example, we have available for everybody that they need the support to see the dangers of the media. So many kids, so many parents in reality has been exposing the children sometimes to see not intentional to see pornography. You know, this is a big issue that we try to teach the parents how to be safe with the kids, especially because the children, they management much better the media than the fathers. So we see a lot impact in the community, especially with Latinos. The kids, they are the teacher for the media. So we have this program in English and Spanish just to offer to the community. Because the spectrum of sexual violence is few, is a lot, the spectrum that sometimes we don't understand. How is this impact? Rape, sexual abuse, sexual assault, sexual harassment. So we continue provide the solution in the community. We cross the line sometimes because we identify so many issues that we have now to collaboration with, for example, Cordea. Cordea is project manager that they working with perpetrators of domestic violence, and we have more collaboration with JJ Peter because we need this support for this organization because we need to provide the services and solutions for perpetrators of domestic violence and sexual offenders. You know, there are increased so many issues in the community that continue in silence, but because we are there, we made a lot social distancing, but we identified that it's very important for providers of mental health to be in contact with Cordea, that is project manager, or JJ Peters, because so many children, so many adolescents, they are perpetrators too. Sometimes it's invisible. So this is one of the community issues that we're confronting, that we try to make the solution. Another work that we provide right now in the community is that we try to working with social justices, because it's very important for migrant communities to identify that they have rights, and we're working with diversity too. We have a program for communities LGBTQ. And just right now, we try to adapting all the solutions for victims of people of rape in Philadelphia. So I'm going to pass to my coworker, Teresa. Please.
Thank you very much. And we both value being a part of this discussion. So thank you. We want to thank our panelists. Their information was really invaluable. We need that information because we pass it on to the people that we serve. And even though we are the Rape Crisis Center in Philadelphia, our reach is large. We are well over 45 years of age as an organization, and we've been had the ability to build strong partnerships throughout the city of Philadelphia, actually, and also in the surrounding communities as well. What we want you to know about our education and training services is that we are now providing all of those through virtual platforms. We are working with schools. Somehow October came in and we were booked. And so schools and other community organizations are reaching out to us to provide the same menu of trainings and workshops that we have provided in person, historically. To our counterparts that are on the panel, if you need to maintain licensure, we know that a number of individuals need that licensure for mandated reporting. We are able to do that through virtual platform for you, so we want you to be to know that. We're actually redesigning the website. Most of the time, people reach out to us through organizations and schools as professionals as well. We are setting up our website so that the individual person in the city of Philadelphia can reach out to us for training if you need for prevention education, especially around sexual violence and family violence. When it comes to domestic violence, we respectfully defer to the 4 significant DV organizations in Philadelphia. And we partner with them and have partnered with them for years. But in terms of the prevention end, when it comes to family or dating violence, WAR has a significant program. Right now, as has been mentioned, we know that the dating violence, the personal violence levels have gone up in the home amongst our youth, amongst families, and our mission is to actually provide people with skills and tools to reduce the risk and to prevent family violence. One of the trainings that we do for parents is what parents need to know about mandated reporting. And as Christina mentioned, there's a lot of internal watching of programming that is not appropriate for children. And unfortunately, the reality of is once that information becomes known by a mandated reporter, it is a reportable offense. So we want our families to be prepared. And so often throughout the year, we provide those trainings for organizations that serve parents free of charge, because for us, the most important thing is to get the information to parents and give them what I call a fighting chance so that there's no disruption in the home. We do provide a menu of programs. You'll be able to check our website for that. We'll type in the WAR website. You just go there and fill out a program request form. Again, within the next couple of weeks, we expect to have a program form for individuals that just want to participate in a training that we give around sexual violence prevention. We provide psychoeducational groups for children, youth, and adults. We also do workshops and community conversations, and you'll be able to check our website for our Facebook and Instagram blast about those services. But if you need us, we're here for you. We want to prevent what's happening in our city. And again, thank you so much for giving us the opportunity. Christina is always available. I'm available. The reality is we do whatever we do our services around education and training. We do it both in English and in Spanish, and we can support additional languages through language access if we need to. So thank you for giving us an opportunity to participate today.
Oh, no, thank you, Ms. Perez and Ms. White, for your work on preventing efforts of domestic violence and also for addressing issues with perpetrators, which usually are the segment of our population that have limited access to services. And thank you for addressing those social justice issues that are part of that ongoing cycle of violence in our communities. Thank you very much for your information. Ms. White and Ms. Perez will provide through our chat a list of those providers that they're working with, such as J.J. Peters and so on. So for those who are asking that question, hopefully we will be able to put that information on our chat. Now, I would like to introduce with a high level of respect and esteem, Ms. Joanna Otero Cruz. Ms. Cruz is serves as a Deputy Managing Director for the Community Services Cabinet. Within this post, Ms. Otero Cruz leads and oversees operations for 311. The Office of Immigrant Affairs, the Community Life Improvement Program, the Mural Arts, Animal and Control Team, Census Counts 2020, the PHL City ID Municipal ID Program, and special projects. Ms. Otero also oversees the City Opioid Response Resources Mobilization Advisory Committee and leads the city's food distribution access efforts on the onset of COVID-19. As you can see, Ms. Otero is extremely busy. So Ms. Otero, the floor is yours. Thank you for being with us. It's truly an honor to have you here. Ms. Deputy.
Thank you, Hector, and the entire Latino Behavioral Health Coalition for all of your amazing work and ongoing dialogue that you have allowed us, as well as the culturally competent providers. It's a pleasure to be here. And to all the providers who have participated, it was really great to see all of the great work that many of my, our colleagues in the city are doing. And it is because of the work that you're doing on a daily basis and ongoing that allows us to continue forward. So again, thank you, as we know is no small task. Now, as I've been asked to cut it short, and as many of you, working from home, we all have to do our parts to help our fellow family members who are not able to work from home. And so therefore, someone has been very, very patient, but she might be on my lap again in just a few, which is my niece. So with that being said, I did, share a PowerPoint. And if we can advance to the slide of city resources, I do know that it would be shared. The entire presentation will be shared with all of you, but I've been asked to cut it short. As you know, in March, when we, in early March, we were all impacted by COVID, and our social interactions have changed since then. And so the city was charged, obviously, to mobilize and activate quickly after the declaration from the governor's office in early March. We activated our emergency center. So our Office of Emergency Management is the office that addresses any kind of natural disasters, any inclement weather, and obviously with the pandemic, we also had to activate. It allows us to begin to coordinate, not just with local operational efforts, but also with our state and federal partners as well. And so on March 11th, the Office of Emergency Management began to activate the city's Emergency Operations Center. And that is something that, again, allows for additional resources to be coordinated. And we also partner, of course, with nonprofits across the city. And so one thing that we activated very quickly, and I want to encourage you all, if you haven't yet done so, is to be able to activate the text messages. The Office of Emergency Management launched 888-777, and if you text COVID, you will get not daily updates now, but in the very beginning, as you can imagine, where people were trying to where to turn, what's going on locally as it related to COVID, it was extremely important for us to have a platform where we can send emergency updates or messaging. So right now you will still receive them probably about weekly, sometimes they are twice a week, depending on what's going on. But that also includes resources, as mentioned by the Health Department, the RFP, or if there's rental assistance, which many of you had questions about. All of those resources are also sent hyperlinked through that text. So again, if you haven't yet activated your cell phone with that text notification, please do so. So that is something that we did quickly so that we can communicate with our residents. In addition to that, we had daily pressers. So daily press conferences that are done bilingual in English and Spanish, and that continues on today, except we are doing them weekly now. So again, we started out daily, then a couple times a week, and now we're doing them once a week. And again, they continue to be bilingual, English and Spanish. For those of you who have Comcast, it's channel 64. For those of you who have other options, it's the government channel, so I'm not sure what those channels may be, but you can definitely look for that. We can also follow it on Facebook, Facebook Live under the Philadelphia Health Department. They also carry it on Facebook. In addition to that, we know that there was great need for food. So food access was something that actually our providers in Philadelphia came to the city and said, we need to have a centralized warehouse for all of the packing of our foods and distribution, because the system was such an overload because the demand was so high. So you can imagine we are in one of the poorest, big cities in the country where food insecurity prior to COVID existed. So a pandemic hitting families that are now with their children 7 days a week was definitely something that was felt by many of our families across the Commonwealth, and no different here in Philadelphia. Therefore, the city, and I had the great privilege with my team to activate a warehouse hub to be able to distribute on a weekly basis 32,000 boxes of packaged goods, both produce as well as shelf-stable goods. In addition to that, we knew that our seniors, many of them would be scared to come to the centers. And so we partner with PCA. I think they're coming up soon. And so we partner with them, who did an amazing job and continue to do a great work with distributing food, but also delivering food as necessarily, working with those to ensure that individuals who were not able to leave their homes receive their daily meals as well. And of course, with the school district, one of our biggest providers, where we were able to activate, over 60 sites for food distribution that continue today. So for food access and all of the additional resources that I'm going to be detailing, you can visit phila.gov/COVID. So phila.gov/COVID will provide you a mapping of all of the 40 distribution sites. Actually, I'm sorry, we are down to 32 distribution sites, and all of the school sites. There's 72 school sites all throughout the city, thanks to our school district and our charters who have also continued to support the effort. In addition to that, you heard a little bit about the COVID testing, so I won't go into detail about that as Rebecca covered that. But again, I just want to put a plug out there. We have many providers on the line, and we are still definitely in need of testing. So any provider interested in the RFP, we encourage you to apply. And again, educating individuals about all of the great, social distancing, washing of the hands, that our health providers continue to tell us still today, or wear a mask. And so we launched an public education campaign in 5 different languages to ensure that individuals were getting information and being distributed in multimedia platforms, as well as old school canvassing was extremely important. And so if you received, or anyone may have received a food box, there were materials that were placed there on an ongoing basis. In addition to all of that, obviously we refer a lot to our nonprofit partners who are doing the social service work, which is really important, but we also knew that the need was great. So along with many nonprofits, there was a PHL COVID-19 fund that was developed with a lot of the philanthropy. And they were able to fund many grassroots efforts that needed to be funded to ensure that basic needs and essential elements were being provided. So whether there was gap in funding, or they had to extend their hours, or they had to have a hotline, they were great different programs throughout the city of Philadelphia that were funded through the PHL COVID Fund. Rental assistance, as you know, the moratorium, when it came to an end, people are behind in rent for several months. And so an effort for rental assistance, there's a phase 2. There was one that was launched in August, and the other is available now through November 4th. So I'm going to give you a website that I think is really important as a resource for individuals that you may be serving and or someone you may know who needs rental assistance. They can visit phlrentassist.org. The deadline is November 4th. And so again, I encourage individuals, don't wait to the 4th, because there are definitely materials that will be required, and also from the landlord. So the landlord has to be a willing participant. And so again, don't wait till the last minute is what I'm encouraging individuals. If individuals have questions, they can call 311. We provide services in multiple languages, and they will, they would guide them through that process. We recognize that while there were resources available for a multitude of different things, there were many individuals who work for cash, who were not eligible for, or who did not get or receive, a stimulus check, or did not qualify for certain things. And that was something that impacted our immigrant community. Those individuals, again, they get paid by cash. And so we developed a workers relief program, which I'm really happy to have had the opportunity to collaborate with the PA National Domestic Workers Alliance, as well as the Commerce Department and the Office of Labor, as well as our Office of Immigrant Affairs. And we were able to provide $1.8 million that were raised through philanthropy, who really really stepped up and said, this is important. People need cash. And so we were able to provide $800 to 2,162 families. What's interesting about that is that we did have it evaluated. Again, it's on phila.gov. But one thing that I do want to highlight is that 2/3 of the money that was spent, that were withdrawn, were for rent. So people did really well with those funds, In addition, all direct purchases, all selling goods were for basic needs, either clothing or food. So there's much more detailed in terms of the evaluation that was done, but at the end of the day, it basically confirmed and affirmed, right? Many of us have been saying, when you give individuals access to resources, they do what they need to do to survive. And so a few other things that I just want to highlight is the fact that, COVID, unfortunately, has exacerbated many of the health disparities that we knew existed. And so the health department is working continuously with many nonprofits across the city and other representatives to really address some of those social ills that have impacted individuals prior to COVID, but definitely have exacerbated the issues around access to healthcare or access to treatment, access to testing, all of those things. It is something that, we really had to put a rush to it. And there is a great dedicated team around that. The other thing that it did not eradicate is the opioid use disorder that we're seeing throughout our city. The young lady who just spoke from Concilio, who talked about, the gun violence being on a high, it is oftentimes related to narcotics. And so we are seeing definitely those increases, and it did not, and what I tell people, the opioids issues did not go away. So we have implemented or reactivated what we call the opioids response unit. And so we have a team aggressively working with the hotspots. In Kensington being the epicenter in our city around the heroin and narcotics issues. As you know, the 24th district leads in homicides, unfortunately. and it is in the poorest congressional district in the Commonwealth of Pennsylvania. So I just wanted to mention that because this, COVID is happening, and it is definitely at the forefront of many things. But it is important to note that the city continues with its, operational duties to address some of the other elements that unfortunately are impacting our residents throughout the city of Philadelphia. And so last but not least, of course, being a Latina, immigrant-related issues are really something that I'm extremely passionate about. And under the current administration, as you know, we have been under attack. And so our Office of Immigrant Affairs continues to advocate for welcoming city policies. And that is something that, we have not closed our eyes at just because of COVID. As we worked with the census counts, we wanted to ensure that people felt safe. And everybody's waiting on the Supreme Court ruling about whether or not our undocumented families will count. But we thank all those families that took the courage to count, because that is extremely important to the resources to come here to Philadelphia. And for all those who are voting as well in the elections, those are another major initiative that the administration, of course, is engaged in, as we hope that to provide safe passage to and from, election sites, to your wards, and to the drop-off centers with the resource centers as well. And I will end with a note that, the resources for children who are learning from home virtually, which we know it is a very challenging for many families. Their resource centers are still available. Families can still visit phila.gov and or their school district website to be able to sign up for the access centers that are available to support families Mondays through Fridays. So with that, I want to thank you guys all again. And if you have any questions, I'm always available via email or cell phone now. So please feel free to share my information, Hector.
Oh,
gracias.
Thank you. Gracias, Joanna. Thank you very much. Thank you to you, your team, and your department for creating lines of communications for the community, educating our community, and most of all, those efforts in keeping our communities safe. So Joanna, thank you very much for all your work, and please let your staff know that all that work that you guys are doing across the city is well appreciated. To the participants, it's 5 o'clock, but we still have, we're almost at the end of our virtual town hall meeting, and we still have great information around senior services, as well as school district and social determinants. So without further ado, I would like to introduce now our next presenter, Ms. Jamie Banks. Dr. Jamie Banks is currently the Director of Trauma-Informed School Practices at the School District of Philadelphia. In this position, Dr. Banks oversees the Office of Prevention and Intervention, where she has been working to further the district's implementation of trauma-informed practices and continuum of mental and behavioral health supports. Dr. Banks, thank you for being with us. The floor is yours.
Thank you, everybody. Thank you for having us. Due to time, we'll definitely be quick, but also please provide my email address with additional questions. Given all that has gone on and all that our families have gone through, you might have heard of what we're saying, initiative called Healing Together, which provide our staff and students with supports in a couple different areas as school started. And we also trained our staff in August. So the areas that we are focusing on are mental health and trauma, social emotional learning, adult wellness, and relationships and community. And so we've offered training and supports for our staff as well as curriculum for our students that we have been pushing out over the last couple of weeks. We've also included student voice where our students grade 6 through 12 have been surveyed every 2 weeks to get their feedback in terms of if they have an adult that they have identified with, how has virtual learning been going for them. We've also been pushing out resources to our counselors as well as our other support staff. And we've also been assisting with building relationships with our mental health providers that now each school is assigned to one. So we've been working with the providers as well as our schools to help kind of bridge that relationship to support the needs for our families. I highly encourage you to go to philasd.org to find additional information about these things. The one thing I definitely do want to leave you with, and one more person is going to speak after me, that she has more information about reopening, but if families are having issues and need help with connections, of course, your school counselor is someone to reach out to. If it's after hours or weekends or frustration, we also partnered with the Center for Grieving Children and started the Hope Line, the Philly Hope Line in the spring. And they can be reached at 1-833-745-4673. They're able to assist in multiple languages, and they provide grief counseling as well as resources. And then we have multiple conversations with them, so we help kind of connect that conversation with counselors and other school supports to help support your child and family. So I'm going to pass this on to Hania so she can speak about the reopening plan.
Good afternoon, everybody. My name is Hania Sharp-Brown. I serve as the Director of Government Relations here at the school district. So I just wanted to give you all a very brief overview of our return to learning plan. Dr. Hite did announce last week our plan to return to in-person learning, and it'll be a phased-in learning approach, very slowly, very safely, to provide our students and families with the option for a mix of in-person and digital learning, which we're calling hybrid learning. It's a very important step for our students, families, teachers, and staff, and we want to just be sure that everyone has the opportunity to become familiar with the plan. Our plan to return to in-person learning is built on 2 pillars: safety and choice. Those are the top 2 things that are really important. I will tell you, I'm a school district parent. I have 2 young people in the school district as well. And so safety and choice is the #1 priority. We will not move forward with in-person learning unless it's safe for all students and staff. And it's also important for families to understand information that we're sharing today. It can absolutely change within the hour, given the climate that we're in, given the advisement that we're going by with health officials. And I'll drop a link in the chat, which will also guide you to the website that literally has everything that you need to know about our in-person learning plan. But what I want to make sure that parents know is around the choice. So the plan has been announced, and beginning on October 26th, the selection process will be for pre-K through 2nd grade families. And so when we talk about that slow phased-in approach, pre-K through 2nd grade will be the first phase of our learners returning back to this hybrid model. So beginning October 26th, detailed information about the selection process is up on the website. Families will be able to go in and actually select whether or not they want to remain whether they want to remain remote or whether they want to take advantage of the hybrid plan. If families decide that they don't want to go hybrid, they don't make a decision at all, it will default to 100% digital learning. So I want to stress that for everyone. I will drop the link in the chat right now. If folks have questions, I can stay on for maybe another 5 or 10 minutes, but that is the most important information that we want to communicate to families about, is this return to learning hybrid plan and the choice that parents have in the decision they need to make that's best for them.
Ladies, thank you very much for such an important information. I'm glad that you ladies and the school district are following common sense approaches to the opioid epidemic regarding the safety of the children and your staff. So thank you very much for that. I truly, truly appreciate that. Now, moving along, we have now Ms. Sharp-Brown She is the Director of Government Relations and Advocacy and External Engagement at the school district, and we have them. So, and she also is the Office of Communications of External Relations, okay? Now, moving along, we are going in for senior services. We have now Lisette Safras. Ms. Ramos Safras is representing the Philadelphia Corporation of Aging, the area agency on aging for Philadelphia County. She's a licensed social worker and a PCA's Latino Outreach Coordinator. Ms. Safras, the floor is yours. Thank you very much for being with us and talk about, such an important aspect, which are seniors in our communities.
Thank you. Thank you for having me this evening. I'm going to briefly go over some of the services that PCA provides, as well as some updates during the pandemic. As mentioned earlier, PCA is the area agency on aging for Philadelphia County. So we coordinate a wide various services in the city for seniors, as well as persons that suffer from a disability. In terms of our mission is to advocate on behalf of seniors and help them enhance their quality of life and helping them achieve their greatest possible levels of health, independence, and productivity. And we carry out our mission by advocacy, fund administration, planning, program development, and service coordination. So many of the services I'm going to discuss today we work with several organizations as well as different providers to deliver those services. Some of the services that we provide are assessment for long-term services and support. And I know Joanna later is going to discuss one of the care at home programs. And we provide assessment to determine a person's clinical functionality. So whether they're bathing, dressing, grooming, just all of the things that would determine their level of care and what type of services and supports they would need in the community. We offer information referral for various resources in the city, such as PICO or Benefili, or just anything to help seniors and their caregivers remain in the home safely as possible, as well as advocacy, caregiver support programs. There's even employment services programs for seniors 55 and older. We offer a wide variety of health promotion programs for our senior centers and in-house, such as chronic health programs, healthy walking programs. And in addition to home repairs, legal assistance that is provided by 3 legal providers in the city, which is Senior Law, Community Legal Services, and Temple Elderly Law Project. And they assist with a wide variety of legal issues, and it's free of charge to seniors. Home delivered meals, which was mentioned a little earlier by Joanna. We have partnered with the city of Philadelphia and our senior centers to offer grab and go meals. And for those who are not able to get to the centers, we are enhancing the home delivered meals. And if they need any additional services, the senior center staff are able to make those referrals. As of now, we have delivered about 1 million meals. So as you can see, there's definitely a need, and there's food insecurity among the senior community. In addition to the home delivered meals, we have protective services, which we offer 24 hours a day. And our investigators receive reports of abuse and neglect, financial exploitation on a daily basis, unfortunately, and we are able to investigate those issues and follow through with the authorities to make sure that these seniors are safe in the community. In terms of, I guess, let me mention the most important thing, our helpline. So to access many of the services that I mentioned today, we do have a helpline, which is 215-765-9040. Our helpline is available Monday through Friday, 8:30 to 5 p.m. We do have bilingual staff, and we do have language assistance. And anything that I mentioned today, you are able to access via our helpline or our website, which I'll link in the chat. In terms of COVID changes, I just wanted to give a few updates. Our helpline is fully functioning. Our senior centers are closed for in-person programming, but they are offering some virtual programming, wellness checks. They're able to call their senior participants, grab and go meals, and any access to other services. Our service coordinators, which are Similar to social workers, they are the ones that go into the homes to develop a plan of care. They initially started going into the homes in September, but unfortunately, due to the changes in cases, that has been suspended temporarily, but the assessments and wellness checks are still going to continue. Our senior companion volunteers are making wellness calls to the senior companion participants, and as well as our advocates are still continuing to investigate reports of any issues in long-term care facilities. OPS, as I mentioned earlier, older adult protectors continue to receive reports. Our home delivered meals has been ongoing throughout the pandemic, and our legal service providers, which I mentioned earlier, are continuing to provide services, mostly virtual. Depending on the issue, if it's an emergency services, they may be able to make a home visit. And our home repairs, sadly, at this point, we're not going into the homes, but things can change, as we all know, depending on how the things are going with the pandemic. And in terms of other virtual events, we are offering trainings for professionals, seniors. We have upcoming a virtual gala and other senior conferences in multiple languages that we will be hosting this year. As I mentioned earlier, Joanna is going to discuss a little bit more about one of the components of the Care at Home programs, as well as her provider information. But you can call our helpline. I'll link it in the chat below. I'll even link my email address if you have any further questions regarding our outreach. And thank you very much. And as I mentioned earlier, we're here for the seniors, for the caregivers, to ongoing support, to making sure that they live in their homes independently and safely. Thank you. Mike.
Thank you. Truly appreciate it. And now I would like to introduce you to Joanna Rosario. She is an activity director of the Aramingo Adult Daycare with over 15 years of experience working with seniors in various states. Joanna?
Thank you very much for this opportunity. I am going to be speaking about two topics today. One is the home and community-based service waiver, and then another one, the service we provide as an adult daycare. So home and community-based services are services that we could get from Medicaid. They're additional to Medicaid, and these are people that want to stay in their own community. So if you want to stay, your seniors want to stay at home and not go to a long-term care, this is where they stay to stay at their home. So this is what they ask for. What do you need to, how do you get eligible? You have to be a resident of Pennsylvania. You have to have a U.S. citizen or non-citizenship or qualify for non-citizenship. You have to have a social security number and meet the care of needs of a skilled nursing facility. And I am going to be talking a little bit further on that specific, how you do that. And also meet the financial requirements as determined by the local assistance office, which is about $2,000 a month and not more than 8,000 assets or savings or investments in a bank account. So it's very easy to apply. There's a couple of different ways you could apply. One is to call the PA independent enrollment broker. You could call it Lisa said a PCA, which the number 215-765-9040, or contact your local county assistance office and let them know that you would like to participate in this waiver. After you do that and start the application, likely said the PCA or the area of aging is going to call you, make a home visit to perform what they call the level of care determination. So it's very important about this, and this is where I'm going to stop and maybe focus a little bit more on that, because sometimes people think they don't qualify just because, oh, I'm not at the level of skilled nursing, you know, I'm not at that level. But it's so simple. If parents, if your loved one is waiting for you to get home to go to shower because they're afraid or at risk of falling, that is right there a need. So, you know, that's a need, and people don't understand that because, you know, oh yeah, I'm getting supervised by my loved one. But again, that is a need. Another familiar one is they don't cook their hot meals because they're afraid that they're going to forget to turn off the stove. So, you know, they wait again for a family member to come in the afternoon to get that hot meal because, again, they are afraid just to, you know, to turn on the stove because they're going to forget. Another easy one is forgetting meds that you have to, you know, at your break time, at lunchtime, call that loved one and say, hey, mom, dad, did you take your medication? So if these are needs, this is a skilled nursing. It's just those simple things. People think that they need to be in wheelchairs. People think that they need to be very deteriorated. No, it's any type of those needs, any activities of a daily living, 2 or more, you qualify. So after the PCA does that assessment, and you guys do qualify, the third step is going through the county assistance office, and they do review the application. They're also sending our certification for the doctor to get signed. So the doctor does have to sign a certification. And also you're going to be asked for financials because the county assistance office reviews and qualifies you financially. After that is done, then the PA independent enrollment broker will contact you, or you receive a letter that you're qualified. That's where you have to choose your managed care organization or your MCOs or your service coordination agency. And they will also do a visit for you to develop that care plan that Lisa was talking about to see what are the needs. Again, with this waiver, you get over 20 services, including, like Lisa explained, home delivered meals, home health services, assisting, adapters, equipment, non-medical transportation. One I'm going to be talking about work as an adult daycare. That's also part of this whole waiver program. So what is an adult daycare? It's a safe place where you could go and have your adult seniors be there safely, and we monitor them in medical, we monitor them in social, we provide lots of social activities for them so they could socialize and, you know, and be social at their age. We also have a nurse there more than 50% of the times, and the nurse there will remind them to take their meds, or will give med passes if they need to because they can themselves. We also have something that people don't take advantage of us as much for this, but we do offer personal care. So if your home is not handicap accessible and the shower is not accessible for them to shower at home, we do have accessible showers and staff trained to do that care if needed. So and we don't get utilized as much of that, but we do provide type of assistance. Again, the benefits are social interaction, provide a structure to and daily activities, and the most important thing also, they also get 2 meals a day, breakfast and lunch, and they're normally hot meals. It's not a sandwich, it's a nice cooked meal that they'll get for breakfast and lunch while there. So that's who we are. Thank you very much for the opportunity.
Thank you very much, Joanna, for that information. And please, guys, remember that access to this type of services are imperative to our seniors. One thing that Joanna hear constantly is that when you ask seniors about their meals, they say that they ate, but when you ask them what, they just had a sandwich, a ham and cheese sandwich. So hot meals, it's something that doesn't happen very often. And people tend to forget that because I'm eating something, that means that I'm eating healthy and I don't need help. So thank you for that information. And now, last but not least, I have Ms. Paola Maisonet, which she is a mental health, Patricia Maisonet is an active public health practitioner dedicated to serving most of, I'm sorry guys, my screen is playing tricks on me, most marginalized communities in Philadelphia. Paola is currently the supervisor for the city's Community Wellness Engagement Unit at DBH IDS, where she provides leadership and public health expertise to a bilingual team of behavioral health specialists and peers with lived experience. Paola is a graduate of Drexel University, Torrance 5 School of Public Health graduate program, where she focused on community health and program monitoring and evaluation. Paola is regularly involved in various research and community-based initiatives, especially among the Latino community in Philadelphia. Paola, thank you very much for being with us.
Thank you, Hector. I'm going to try to be as succinct and brief as possible. I just have 2 slides to go over with you guys. So today, like I mentioned earlier in the program, DBHIDS has many divisions and intern units. The unit that I will be focusing on is on the Community Wellness Engagement Unit, the program that I manage. From its inception, this program was built and continues to be developed using a population health framework. With that, we have various values within our team. And if we can go to the next slide instead first, and I'll go over a little bit of our values. So first, our skilled team has specialists with lived experience and engagement in the community. What we mean by specialists, that's comprised of certified peer specialists, certified recovery specialists, behavioral health specialists, and new to the department is community autism peer specialists. And with these trainings that are offered in the department, the qualifications to be a certified peer include having some sort of lived experience, whether that means a particular trauma, substance use disorder, or mental health challenges. And this is really pivotal in creating our team, where peers offer a powerful tool that first, they're an inspiration of hope, right? They are an example that long-term recovery is possible. And also peers offer a plethora of resources because of the lived experiences that they have gone through. So our team is comprised of that. Our team also values wellness because we know that factors that are related to the social determinants of health, like our education, our work, our housing, which was very much talked about in this webinar, our built environment, the pandemic that we're going through right now. These social factors, social cues can affect our physical health and also our behavioral health. So with that, the mission of our team is to provide wellness-related resources that can include many of these social factors, right? Also with that, our team practices wellness internally. We do various activities based on recommendations and trainings and events that are offered within the department. And I encourage both residents, providers here on this panel to really prioritize their wellness, most especially when we're going through such uncertain times really in our city and our nation. So really encourage that. Third, our team values cultural and language differences. So we know Philadelphia is a very diverse city. For example, in the first team that we have built, which is within Council District 7, which includes the neighborhoods of Kensington, Frankfurt, Hunting Park, Fairhill, we see based on census data and some department data that there is a 65% of the residents there, their predominant language is Spanish. Because of that, the team that we have dedicated to Council District 7 is fully bilingual in Spanish and in English. This is critical when it comes to our engagement because it's another layer in which we take that population health approach. Next, our team is community driven. We want to hear the community's voice. We are regularly attending, whether it's virtual and now in person, as we're in the green phase and practice social distance and all the recommendations. We are regularly trying to reach the community, attending forums so that we know the needs that are expressed in communities and can deliver those types of concerns back to the department so that we can have a strategic approach. Lastly there, our team is mobile. This has been especially important as we continue to adapt to our environment during COVID, where we know that to be accessible to the community is not necessarily to have a physical location, a physical space, but it's based on your partnerships. So we try to be accessible by creating numerous partnerships and collaborations with grassroots organizations, faith-based churches, the various city agencies, and we regularly rely on them to be accessible to the community. Can we go back to the first slide, please? And on the left, you'll see what I briefly went over. Really, our values are pillars to our team: peer support, recovery, family inclusion, wellness, and community and collaboration. We can be contacted if you haven't seen us out in the community. We have a picture. We're known as the blue team out in the community a lot. If you haven't seen us, you can also reach us at our centralized email, cweu@phila.gov. I also encourage folks to visit dbhids.org to get updated on events, forums, sessions that are going in the department. We have a lot of work going, and again, can't stress enough to prioritize our wellness. So thank you, everyone.
Paola, thank you very much for such an important information, and thank you to you and your staff in your department for the innovative work that you guys are currently doing here in Philadelphia. We actually got to the final part of our town hall meeting. Anything that we do in our community requires us to be familiar with its needs as well as the available resources that we have in our community. Taking the time and effort to understand your community well before embarking on any community effort will pay off in the long term. Today, we were able to understand the range of community services available and understand how to access those community services. As you can see, there are many community resources. We have many skilled, trained professionals and staff carrying across the spectrum of services. Within the community, communication and coordination, we saw today that is critical, and patient, consumers, clients, and family involvement is a must. Also, please remember that your ability to identify and organize assets and resources to help those you serve will help them achieve their objectives. And by knowing your community resources, increase your skills and your knowledge, abilities to access, use information, and resources to create strategies and partnership that will be in the advantage for our clients. And in the long term, also facilitates communities' well-being and quality of life and resilience. So thank you very much for your time. Thank you for being with us. It's been a great pleasure to have you panelists and experts as well as participants. I hope that the information that we were able to provide today can help you improve your practice, improve your work, and at the end of the day, change the quality of life of our community. Thank you very much. Have a great evening, and looking to see you all soon. Have a good evening. Thank you.
Thank you.